Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 67-year-old female is being evaluated for complaints of depression. She has always struggled with times where she was down, but never liked taking medication, and has tried to treat herself with nutraceuticals. Her symptoms have gotten much worse lately because her husband died and she is struggling with that. She has been seeing a therapist for the last few months, but is not feeling any real improvement. When considering pharmacotherapy for her, which of the following medications should be avoided? A. Sertraline, B. Bupropion, C. Escitalopram, or D. Citalopram. So this clearly is a pretty straightforward question, obviously a patient management question, and more obviously a pharmacology question since your four options are various pharmacology choices. So specifically, the question is what should be avoided? And it's always helpful to really focus on exactly what the question is asking of you, because in circumstances like this, especially if you have a little bit of anxiety going into your test, it's very easy to find yourself considering each answer choice and trying to decide, would I use it? Would I not use it? Would, this one be better than that one? And honestly, for this question, it doesn't matter what you would use. You might use, one of any variety of options. The question here is what should be avoided. This really is a safety question. And as I'm sure you know, I'm sure you've heard this several times already, an important part of your certification exam is ensuring that you are safe to enter practice and that you can identify right off the bat what should be avoided or what is unsafe in certain patients. Nuances amongst best choices, that will develop and come over time. You might have 3 or 4 options for a patient and they're all reasonable and safe, and you decision among them, and your first choice sometimes might not be the best evidence-based approach, but if it's safe and effective, fine, you'll figure out those nuances later. But your boards does want you to be able to identify right off the bat what is unsafe or what should be avoided. So as you look at these 4 answer choices, D is the correct answer. While SSRIs are generally considered safe medications, citalopram specifically is associated with a prolonged QT interval and carries an FDA black box warning about the risk of prolonged QT interval. It's the only SSRI with this black box warning, and doses above 20 milligrams are not approved in patients over 65 years of age. Actually, doses above 40 milligrams are no longer approved for anyone, but nothing more than 20 milligrams is approved for an adult over 65. And so since we have so many other options here, citalopram should be avoided in a more mature adult, in an adult over 65 like this patient is. A is very commonly used as a first-line agent in older adults, as it is particularly useful in anhedonia, dysphoria, this kind of depressive symptom where they're sad, they're struggling, can't be happy about anything. It's particularly good for that, and it is particularly safe. And as a side note, even though Celexa or citalopram is the only SSRI with the black box warning about a prolonged QT interval, almost all of them prolong the QT interval to some extent, but sertraline appears to be the best option. So if you do have any concerns about the risk for dysrhythmia, the age of your patient, etc., sertraline appears to be the one with the least QT prolongation risk. And it has the advantage of being particularly useful for this symptom complex. So that's great. On the other hand, B, bupropion, is also particularly useful in dysphoria, and that would be a reasonable option here. Bupropion isn't the most powerful antidepressant because it doesn't have any serotonergic activity, but it also has a pretty tolerable adverse effect profile. So depending on how bad the symptoms are or not, bupropion might be very reasonable in this patient. One thing about bupropion that's not as prevalent in other antidepressants is that because it is a dopamine reuptake inhibitor, it can be a bit activating, sometimes can make people feel a little antsy or a little restless or even a little bit nauseous. Not always. In fact, not even most of the time. These are side effects that can happen. But remember, dopamine does tend to be activating. So in the same way that it can improve mood and it's, considered the happy neurotransmitter, it can be activating. So if your patient has a strong anxiety component or, even a strong GI component like perpetual nausea, perpetual diarrhea, this might be something to avoid. But it's not unsafe, and it certainly is something you can consider. And then C, escitalopram, is particularly advantageous in terms of its pharmacokinetic profile. Remember, this is the one SSRI that does not have any cytochrome P450 interaction concerns. And so, since in the older adult we have to be always cautious about drug interactions because statistically, the older adult is on an average of 6 medications, believe it or not, on a regular basis. And so, again, the bottom line is A, B, or C. They're all reasonable considerations, but the question for you is what should be avoided, and the one that should be avoided is the one with the black box warning about QT prolongation and a dose limitation in patients over 65.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.